Hi everyone, I will explain about schizophrenia disorder. What is schizophrenia disorder? Schizophrenia disorder is a form of psychotic disorder, so some psychotic symptoms, plus other stories to cast time period. The consequence of the disturbance and do not overlap with other similar disorder. The psychotic patient cannot recognize or have no contact with reality. Some of the psychotic symptoms are delusion, hallucination, chaotic speech, and chaotic behavior. Schizophrenia is a serious persistent brain disease resulting in psychotic behavior, concrete thinking, and internal difficulty processing information, interpersonal relationship, and solving problems.
Hello my friend, my name is Yuan Gustirana. I will explain the causative factors schizophrenia. Several factors are risk factors for schizophrenia. That is, factor 1, abnormal structure of the brain and central nervous system. Factor 2, genetic factor from parents. Factor 3, lack of oxygen, lack of nutrition, and exposure to virus while in the womb. Factor 4, born prematurely. Factor 5, increase activation of immune system. Factor 6, serotonin and dopamine level imbalance. Factor 7, increase activation of immune system. Factor 8, abuse of illegal drugs.
The symptom the the symptoms of schizophrenia are divided in two categories, namely positive and negative. Positive symptoms refer to behaviors that are not seen in healthy individuals, including hallucination. Hallucination is the feeling of experiencing something that feels real, but actually that feeling is only in the mind of the sufferer. Delusion or understanding is believing in something that is contrary to reality. Symptoms range from feeling weighted, followed, or feeling the greatest or stronger. Most schizophrenics experience this symptom. In addition, people who have schizophrenia also tend to have paranoid thoughts, disturbed thinking, and speaking. This symptom can be seen from the sufferer's difficulty in speaking. Schizophrenics find it difficult to the sufferer can suddenly scream and get angry for no reason.
Here are 5 types of schizophrenia whose clarification was used as a reference by prevention experts. 1. Paranoid schizophrenia. This type of schizophrenia is the most common syndrome, including delusion and hallucination. People with paranoid schizophrenia usually exhibit abnormal behavior as if they were being watched. So they often show angry, anxiety, and even hatred towards someone. However, those with these types of schizophrenia style have normal intellectual foundation and expression to cognitive schizophrenia. Cognitive schizophrenia is characterized by movement disorder. People with this type of schizophrenia tend not to have or more hyperactivity. In some cases, it was also found that they do not want to speak at all, or like to repeat what these others say. People with cognitive schizophrenia also often do not care about personal hygiene and are unable to complete the activities they are doing. 3. Schizophrenia irregular. Irregular schizophrenia is the type that is less likely to be cured. People with these types of schizophrenia are characterized by disordered speech and behavior that is difficult to understand. Sometimes they can look for not appreciation of look based with the preparation they have. 4. Differentiated schizophrenia. This type of schizophrenia is the most common. Its syndrome are a combination of variation subtypes of other schizophrenia. 5. Residual schizophrenia. Residual schizophrenia usually do not show common syndrome of schizophrenia such as delusion, hallucination, disordered speech and behavior. They were only diagnosed after one of the 4 other types of schizophrenia had occurred. Thus are some types of schizophrenia that have existed and are used as a reference. It shall be noted that people with schizophrenia are initially usually aware that they have this condition and need treatment.
Non-pharmacological therapy. Number 1. Psychosocial therapy. With psychosocial therapy, the patient is intended to be able to adapt again to the surrounding social environment and to be able to take care of themselves, be able to be independent, not depending on the others, so that it does not become a burden to the family or society. The patient is strives not to be alone, no daydreaming, lots of activity and business, and a lot of socializing. Number 2. Psycho-religious therapy. Diversity therapy for schizophrenia turned out has the benefit, for example, the clinical symptom of schizophrenic turn out. Disorder disappear more quickly. Religious therapy is mean the form of religious ritual activity such as praying, praise to God, religious lecture, and study of scriptures. Number 3. Physical therapy in the form of exercise. Number 4. Various activities such as course or tutoring.
Negative symptom of schizophrenia. Symptom number 1 is the natural sense is dull and tired. This picture nature feeling can be seen from the uncooperative face. Number 2, withdrawing or isolating themselves, will not socialize or contact with other people, and lost in touch. Number 3, emotional contact is poor, hard to talk to, and be quiet. Number 4, passive and apathetic, withdrawing from social society. Number 5, hard to think abstract. Number 6, there is no impulse of will and no initiative, and all around the lazy.
In here, I will explain about pharmacological therapy in schizophrenia. Antipsychotic medication are also known as neuroleptic as well as major transcendents. Antipsychotic drugs generally calm down by disturbing consciousness and without causing excitation, paradoxical. Antipsychotic in the therapy of acute and chronic psychosis or serious mental disorder. The most important features of antipsychotic drugs are 1. Useful for overcoming aggressiveness, hyperactive, and emotional lability in psychotic patients. 2. Large doses do not cause deep coma or anesthesia. 3. May cause reversible or extrapyramidal symptom irreversible. 4. There is no tendency for psychic dependent on psychic. Mechanism of action. Antipsychotic inhibit somewhat strongly of receptor dopamine D2 in the limbic system of the brain and also inhibited its receptor D1 or D2 at adrenergic, serotonin, muscarine, and histamine. However, in patients resistant to classical drugs, it has been found also complete blockade of the D2 receptor. New brain research has shown that D2 blockade alone is not always sufficient for tackling schizophrenia effectively. For disorder, neurohormones such as serotonin, glutamate, and GABA need to be influenced. Thank you.